So as Dick Michaud told you last night, you are at the largest gathering of PKU ever in the world. So you have already helped us make PKU history. So thank you so much for that. We have 529 adults, families, grandparents, professionals, industry leaders with us this weekend, coming from 8 countries, and we're actually up to 33 states. Thank you, Nebraska, for that. The NPKUA works to improve the lives of individuals and families with PKU and pursue a cure. That is our mission. We were created by people just like you back in 2008. All of the different state and regional organizations across the country got together to form us. So we are made up of all those different state and regional organizations. All of them have a seat on our board of directors. All of them, just like you, have a personal connection to PKU. Their parents, like myself, their grandparents, and their adults living with PKU. All of us on our board understand that research is essential for better treatment options, and advocacy and education are essential for PKU care. We announced our first research awards 2.5 years ago at our inaugural conference in Dallas. And since then, we have awarded close to $500,000 in grants for people that are working on better treatment options, trying to expand the knowledge base of PKU, and also bench research aimed towards a cure. And as Dick told you last night, all of the funds raised for our research program were raised by people just like you. All of those walks and those golf tournaments and those 5K runs and those trivia nights and Comedy for a Cure, all of that money raised throughout the country has funded these 5 researchers that you will hear from over the course of the weekend. For our research programs, we fund pilot studies that will hopefully lead to further leverage more substantial funding from NIH and other entities, all aimed at expanding the knowledge base for PKU. And the wonderful thing about our research program, and I think our member organizations, is prior to 2008, California would have a fundraiser and they would fund a particular researcher, and there might be a walk in Pennsylvania, and MacPad would fund a particular researcher, and Illinois would have a walk and they would fund a different researcher, and there was no coming together. And you know what? We're really never going to make a difference in this disease until we all come together, pool all of our funds together, have a process to receive proposals, have those proposals reviewed for scientific merit to make sure that we're investing our money wisely. So that has been a huge accomplishment, I think, of ours in the last 2 years. We also have a fellowship program. You'll be hearing later this morning from Dr. Kristen Skvorek, who's here. Dr. Roberto Gramignoli just finished his fellowship with us a few months ago. And our fellowship program is really aimed at attracting the best and the brightest postdoc researchers and get them excited and involved in PKU. Many of you have been involved in this community much longer than I have, but you've probably noticed the same thing. And I'll just point you out, Dr. Levy. You know, Dr. Levy is an incredible researcher, incredible work, incredible clinician, but you guys, eventually, he's going to have to retire. I hope not for a long, long time, but a lot of our best and our brightest, you know what? They're getting a little gray. And so what are we doing to attract the best and brightest into our disease? And that's what our fellowship program is all about. We also have a main focus on education in the National PKU Alliance. What we're really here to do is to help you connect the dots. So our website, where all of you will soon be featured, right, in our new photos, a refreshed look. That website, for example, in April and May, we received over 30,000 unique hits. And of that, over 1,000 of you spent more than 30 minutes on our site, learning about PKU, getting practical tips, connecting with local organizations, and also learning the latest in research. One of the other things we're trying to do is really change the way that we all experience PKU. So putting out educational materials such as my PKU binder, which is a comprehensive manual on PKU management. Everything from emergency tips to traveling, what happens when you get stuck at the airport, delays, what are some things that you should think about when packing, to tracking your progress, to handouts for babysitters, for childcare providers, for teachers, sample letters to send to your insurance company when they won't cover your formula. All of those are in my PKU binder. We're also working to help you understand better the research that is happening with PKU and having access to the best practices. I'm simply amazed that our PKU in the Brain, which is based on a supplement that was published by Molecular Genetics and Metabolism back in 2010, that talks about the latest research in PKU and neurocognitive development. I've actually heard from families that have used parts of this and shared it with their school administrators, and their children with PKU are finally getting the services and support they need to make sure that they're getting the best education in their schools. Anybody in here have a birthday this month? All right, happy birthday. Anybody in here have a birthday this year? So, what happens? For those of us that have children with PKU, they have birthdays just like us. Guess what? PKU children have birthdays and they become PKU adults. The NPKUA realizes that our adults in our community have some really great needs and some special needs. And so we actually have a PKU adult program co-chaired by 2 adults with PKU on our board. The whole premise of the PKU adult program is to offer support and connections to adults living with PKU in our community. The program late last fall produced a book that was written by adults with PKU for adults trying to return to diet. We understand that many of our adults are struggling and will continue to support them with peer-on-peer programs, a new adult website, and other programs for them. For maternal PKU patients, we have an emergency assistance program for those women with PKU who are pregnant and cannot afford or do not have coverage for low-protein foods. And later this fall, we will be training our first mentors, so women who have successfully given birth to healthy babies, pairing them up with women who have PKU that are pregnant or want to get pregnant. We are a national voice at the National PKU Alliance, created by the local organizations, and much of our work is also centered around advocacy. Everyone in this room knows what this is. This saved the lives of 2 of my sons, who are now 4 and 6. This test changed the lives of so many people in this room and the lives of our loved ones. However, for those of you that live here in the United States, know and understand that there is a huge disconnect in our country when we have a test that can save the lives of our children with PKU, but what good is a test if you don't have coverage for the medical foods needed to keep your children healthy? So I know right now is a very diverse banter in our country around politics, and I don't really care what political belief or political motivation you come from. I believe we all know and can come together around the importance of having access to the medical foods needed to keep everyone with PKU healthy. It doesn't make sense to me that right now in our country we have a patchwork of laws, and coverage for your medical foods depends on where you live or what type of insurance you have or how old you are or if you are male or a female. Coverage should be for everyone. We have introduced in Congress the last 2 sessions the Medical Foods Equity Act. We all know that not much is getting passed in Congress these days, but we're continuing to educate our congressional members of Congress and talking to them about the importance of all insurance companies covering medical foods, of TRICARE for our military families covering it, for those of you that are under self-funded programs and can claim an ERISA exemption, that all of you have coverage for medical foods, as well as our federal employees. We'll continue to educate members of Congress, and we really are creating a unifying voice for PKU. So we do have a seat at the national table. We've earned a seat at the national table for national policy, research, and healthcare as those agendas are set. And my second way that I need help from you this weekend is please visit our advocacy table right near registration that is being put on by Partners in Education. What we're simply asking you to do is to tell your story and just answer the simple question, what does access to medical foods mean to you? We will share your stories with the Department of Health and Human Services as they continue to implement the regulations around the Affordable Care Act. We'll share your stories with members of Congress and with other policymakers in Washington, D.C. I don't care if you're Democrat, Republican, socialist, independent, libertarian, all I'm asking of you is that you share your story of what access means. So thank you so much for being here with us over this long weekend. Thank you to our board of directors, our member organizations. You know, we have accomplished a lot in the last 2.5 years, and Dick said yesterday that, well, the organization is run by Christine Brown. Well, in many respects it is, but I can't do all of this alone, and I certainly have done none of this by myself. It's all been through our board members, our local organizations, other staff, and our volunteers that really have accomplished so much. And so I know that many of you are new to our organization. I hope this conference will give you a testament to the work that we have done, but also the work that we need to continue to do together. And I'm so glad that you all have become a part of our family, and I look forward to working with you in the years to come. Thank you.